during pregnancy than at other times. Your body produces cortisone every day, and when it stops, you die. 29-year-old Gladys came before the great Hench bedridden with arthritis. Unable to reduce her symptoms, Dr. Hench recommended she return to Kokomo, Indiana. Gladys refused, saying, "I came for help, I didn't get it, and I'm not leaving until I get it." And some of you men might know women like this. Dr. Hench replied, "I have this idea." She said, "I'll take it." The idea was cortisone. Gladys was the first in the world to receive cortisone. Dr. Slocum on the left administered it. 7 days later, Gladys shopped 2 hours straight, walking on her own in Rochester, Minnesota. The miracle of cortisone was born. This Mayo Clinic team of 4 was awarded the Nobel Prize for discovering the miraculous effect cortisone has on arthritis. The great physician instructs, visit rheumatologists. Rheumatology is the study of arthritis. Rheumatologists are arthritis specialists. We asked rheumatologists to guide us. They directed us to study inflammation. Inflammation is caused by injuries. The injury site becomes painful, swells, warm to the touch, and redden. Heat, redness, pain, and swelling are the 4 cardinal manifestations of inflammation. With inflammation, the blood vessels enlarge and become porous. Through the porous blood vessel doors flow blood plasma, ripping apart flesh, creating rivers and pain. The extra fluid is the swelling. The redness is red blood cells that come along with the plasma. The warmth is due to the warm inner blood arriving at the cool skin surface. Why does the body inflame from an injury, I ask? And the rheumatologist replies, upon getting an injury, the body assumes the skin was broken. Through the broken skin enters bacteria that live on the skin and all over. Once inside, the bacteria find water, warmth, and food sufficient to multiply and kill the body through a process we refer to as infection. But people don't die from a fall, an injury that breaks skin. That's because the body has a second defense line, the immune system. In the blood are special immune cells. When these cells encounter a bacterium, they swallow it and digest it. And by so doing, the body is protected from the infection. However, the immune cells cannot leave the blood vessels unless the doors are open. The only place the blood vessel doors are open is at the site of the injury. There, the immune cells leave the blood vessels and migrate down the preformed rivers to the site of injury to carry out a war. The body soldiers the immune cells against the invaders, the bacteria. I like that. So inflammation is a war. It's about like that, the rheumatologist replied. There's another inflammation you must know. Let me walk you through what we understand about an inflamed joint. This is a picture of a normal joint. Blood vessels are in the walls of the sac that hold the joint's lubricating fluids. This is a picture describing a joint with inflammation. The blood vessels are enlarged and porous. As the heart pumps, blood plasma flows through the vessel's open doors, painfully stretching the sac containing the joint's lubricating fluid, and overpowering the drain illustrated on the lower right. The result is swelling and pain. If this inflammation were allowed to continue, it would destroy the joint. I ask, how can the joint destruction be prevented? First, excess fluid is drawn to reduce the pressure. Then cortisone is injected into the joint. Cortisone reduces blood vessel size to normal and closes the doors. The leaky blood vessels are sealed. With the leaks sealed, the heart cannot pump extra fluid into the joint to maintain the swelling. The excess fluid already there exits down the drain. With this, the joint becomes normal-sized again and pain leaves. Well, I like that, but I don't get it. Inflammation in a joint destroys the joint. Inflammation from an injury stops infection and saves lives. Are they the same? Yes. Well, then now I am really confused. Time. Inflammation from an injury lasts only a day or so, then heals. Inflammation in a joint with arthritis lasts months. So am I to conclude that the inflammation war destroys what it is near? The rheumatologist replies, yes. The short-term inflammation from an injury causes negligible destruction. With long-term inflammation, destruction accumulates and destroys what it is near. Then is long-term inflammation arthritis? That's about right. Is short-term inflammation arthritis? No. So the only difference between good inflammation and arthritis is the time that the inflammation remains in the body. Yes, that's about right. The rheumatologist replies, well, the body must have a gate to keep short-term inflammation from becoming long-term inflammation of arthritis. What is the gate? We don't know. I'm thinking in Helen, this gate is broken. I suspect cortisone is the gate, but I don't know how it works. And at this time, Helen's hands were swollen like balloons and everything else that goes with it. We were in a hurry. I asked the rheumatologist, why don't you give cortisone to Helen? We can. She could become pain-free in a week or so. If we gave her cortisone for very long, she'll get the side effects. We use it short-term all the time to save asthmatics' lives, by injections, by pills for poison ivy, for organ transplants, for cancer chemotherapy, and so forth, without side effects. We don't know how to use it long-term without getting side effects. It doesn't take long on reading medical journals before one realizes cortisone is king for controlling inflammation. Only cortisone has the power to fully reverse all symptoms of arthritis. We scientists have been trying to design drugs to beat cortisone for 50 years and haven't come close to even matching its control over arthritis. If we could get rid of cortisone side effects, would you then use it? I ask of the rheumatologist. Of course. I began smelling stinking thinking. Our bodies make cortisone. It's always in our bodies. It is the best for controlling arthritis, yet it can't be used long-term to control arthritis without getting side effects. This didn't feel right. The great physician instructs, study hormones. A hormone is made by a gland of the body that has a regulatory effect somewhere else on the body. Cortisone is made by the body's two adrenal glands on the top of each kidney and helps regulate blood sugar, heart performance, adrenaline production, among others. Indeed, cortisone is a hormone. Endocrinologists study hormones, so I go to the endocrinologists for help. The rheumatologists have given us wonderful guidance. Please teach us about cortisone. All right, our bodies produce a low level of cortisone 24 hours a day. When that drops to zero, the body dies. I thought, well, that can't be Helen's problem. She's living. I asked, what else? Psychiatrists find that when they scare people, a large cortisone pulse occurs in the blood that lasts only 5 hours. The surgeons say they get the cortisone pulse in the blood when they cut people. And I thought, the cortisone pulse must be the gate between short-term inflammation and long-term inflammation of arthritis. Let's suppose an injury occurs. Short-term inflammation results. The cortisone pulse follows, stops inflammation, and allows healing. The endocrinologist adds, allergy, infection, and stress also cause inflammation. Well, I'm not sure that I want to know that. So injury, allergy, infection, stress cause inflammation, is